1 out of 5 people's depression is actually a bipolar form of depression. Unipolar depression, which is just an episode of depression and then a period where you're free of depression. And then there is a bipolar form of depression, which means an episode of depression could be followed by a period where you are free of any symptoms, and you could also have an episode which we call as mania. Mania is a state of mind in which you have excessive levels of energy. A person can be hyperverbal, cannot sleep, hardly sleeps 3 to 4 hours. Their judgment can be affected. They're impulsive. They can have anger outbursts. They can resort to violence, spend a lot of money. They can make unnecessary impulsive travel. Sometimes they can also become psychotic or delusional. It's usually during the depression that you go seek help, but some of the primary cares don't know the difference. So your primary care puts you on one antidepressant, you don't get better. Sometimes they keep increasing your dose and you get even worse. Many times they stop one antidepressant, put you on another antidepressant. Your anxiety gets even worse. And then they may put you on a benzodiazepine like a Xanax or a Valium or an Ativan, which does decrease your anxiety but does nothing for your depression. If there is a bipolar form of a depression, there is a different class of medications which is used. We call them mood stabilizers. Talk to your psychiatrist. They can explain to you what a mood stabilizer is.